leveraging PCMH and PCSP, which are the acronyms for Patient-Centered Medical Home and Patient-Centered Specialty Practice, for practice transformation. Our presenter today is Vance Drakeford, a quality improvement advisor with the Kentucky Regional Extension Center. Vance is an NCQA patient-centered medical home certified content expert and is the team lead. He has over 6 years of PCMH and PCSP advising experience and has been in healthcare for nearly 12 years. Vance holds his MHI with a quality improvement focus from Northern Kentucky University and has additional experience with EHR implementation, the quality payment program, and Mips support and quality improvement projects. As before, if you have any questions for Vance, please enter them in the chat box and we will get to them at the end of the session if we have time, or we will contact you directly after the event. Take it away, Vance.
Well, thanks, Catherine. Welcome everybody to today's session. So glad to have you guys join us today. As we get started here on our presentation for PCMH and PCSP, I just kind of wanted to go through what we were going to talk about. So our objectives for today's session. So first of all, just kind of wanted to talk about just an overview of what is PCMH and what is PCSP. Like Catherine said, it is patient-centered medical home and specialty practice. That's what that stands for. We're going to go over those fundamentals and then kind of dive into what is value-based care and why is that important? And maybe how those two things correlate, PCMH, PCSP, and value-based care. And then kind of look at a way to do practice transformation your own way and do a personalized path through that. And then kind of focus on, how the REC, we can help you do those items as well. And then we'll get to any questions if we do have time at the end of the session. So let's get started. So as we talk about just the fundamentals of PCMH, what is that? Some people think, is that an actual place, a patient-centered medical home? It's actually a model of care. And so PCMH is really set up as a roadmap to guide your practice towards transforming into that model of care that really includes developing that strong relationship between the provider and the patient and their caregivers, as well as coordinating care between other specialists and other healthcare pieces to that puzzle. And then also focusing on access, maybe with expanded hours and online tools to help your patients with resources to navigate through their health journey. And then sharing decisions to make more informed decisions for the patients. And so that patient has a say-so within their own health. And so they know exactly what's going on, and that strong relationship between that provider and clinician can be built. And then talking about lowering costs. How can you make savings through this? PCMH and PCSP can help reduce those costs, make savings for your practice and your organization in a safe environment as well. Now, currently, we here at the REC, we use the NCQA, Patient-Centered Medical Home and Specialty Practice a program. That is the gold standard across the nation. They have the most number of clinicians and providers, practices across the country that are in this model of care. So that's who we use. In fact, there's over nearly 12,000 practices in the United States currently. So let's move on and talk about the different concept areas within the program. So PCMH and PCSP both, they have concept areas that you go through. And there are 6 concept areas within the PCMH model. And as you can see them here, you have team-based care. And then within this, you're going to talk about practice leadership, orienting your patients and families and caregivers to your practice and to the model of care. And then also care team responsibilities. That's what you're going to talk about in that concept. And as you move on to KM, or knowing and managing your patients, this is about collecting data. How do you collect your data? How do you reconcile your medications, connecting with the community, and using that evidence-based CDS or your clinical decision supports within your system. And then you have patient-centered access and continuity. There you're going to talk about empanelment, access to your practice, same-day appointments, those kind of things. And then care management and support is that fourth concept within the program. Here you're going to identify those chronically ill patients that need that extra bit of care and need that extra touch to help through the journey, and really develop those care plans that are important for their journey and to help them make the most improvement. And then care coordination and care transitions. That concept area is very much like it sounds. It's talking about coordinating your referrals, transitioning that patient maybe back from the hospital back into your primary care practice or your specialty practice, whichever that may be. So that's what you would be entailed in doing for that concept area. Now, the last one, the performance measurement and quality improvement. We've been talking a lot about this topic this morning with data validation, PDSA cycles within the Diabetes Learning Collaborative, and as well as in the Mips program of how important that is. So that is really what this last concept area is for this program, is building quality improvement, how to set goals, how to set some interventions to try to make some improvements, and then see if you've met those goals with that. So that's the last concept area of PCMH. And as we talk about PCSP, you're going to notice they look almost identical. The only thing different here, you're going to see that little gray box there, initial referral management. That is the only difference in the two concept areas between the two programs, whether it's primary care or specialty. And so here, as a specialist, you're going to focus a lot more on that initial referral management. So they want to make sure when that primary care provider or another provider transfers a patient to your care or refers them into your office, that coordination is really focused in on and make sure that patient is not dropped and that ball is not dropped between those different appointments. So you know exactly why you're receiving that referral, what the diagnosis is, or were there any tests done before they were sent to you, and then vice versa. Once you complete your visit, that you also send all of that information back to that referring provider so that patient is well taken care of, and that everybody that is helping that patient in their care knows exactly what's going on, and the communication is top notch. So now that you know a little bit about the different concept areas for the PCMH and PCSP programs, what are some benefits that you can get out of PCMH, well, and PCSP? NCQA did a survey a couple of years ago over thousands of different clinicians and organizations that are PCMH or PCSP. And they have found a lot of great information within the survey. And one of those benefits that I wanted to talk about today is those health outcome benefits. Some of those that you can see here on the screen that I thought was really great. By being in a PCMH model, they saw better A1C testings, better cervical cancer screenings and nephropathy monitoring, and then those fewer all-cause hospitalizations. So they really saw some significant improvements in those health outcomes. And not only with PCMH and PCSP do you get some health outcome benefits, but there's also some benefits for the patients within this program. That study also found that 73% of patients actually want PCMH style of care, and 61% of those patients felt like that PCMH care would actually improve their health. Well, actually, what they found out is that in that study, 83% of patients within this model actually saw improved health, and they also had an increased rate of same-day appointments occurred for the patients. So the patients, these were some of the benefits for patients that I wanted to share with you. Now, not only the health benefits and patient benefits, but the staff has seen benefits by being a PCMH model or PCSP model. And here you can see some of those things. Going and transforming your practice to become that PCMH model. A lot of practices are already prepared and are pretty much doing what they need to do to be a PCMH or PCSP practice. However, there's some tweaks and there's some little challenges that you have to go through to make sure that you meet those requirements. And, with that, there is a little bit of work, but after that work is completed, the staff has really noticed these benefits and really connected to their patients. That relationship for the providers has become stronger. That patient feels more confidence within their care team. And it really makes the team more efficient and works well together. It makes their job better, makes them happier, and streamlining their processes so everybody's consistently doing the same things the same way, and really enjoying learning about their patients in that daily huddle and how that day is going to go. It just makes things so much better and equal, and getting the patients involved in their own care and in that quality improvement process really has benefited, and made that job satisfaction for the staff a lot better with this type of model. Now, probably the biggest question as we move forward, that people ask me, like becoming a PCMH or PCSP practice, not what are some of the other benefits? What are the financial benefits? So as you can see here, probably the one in the middle sticks out to me the most. But with this type of care, PCMH practices have seen almost an $1,100 lower average per patient total Medicare spending. And that was with a study of over 190,000 different beneficiaries within this model. That is significant, $1,100 decreasing cost for that spending. You also saw lower acute care hospital spending of 62%. And you also saw a reduction in that ED utilization and savings of about $5 million per year by reducing those ER visits. Instead of just going to the ER, the patient understands that they should call their primary care practice first before they just john off to the emergency room for that visit, and see maybe if the primary care office can actually help them that day. And then also a reduction of over 10% in that ambulatory care sensitive inpatient admissions with 2 or more comorbidities, focusing in on that care management piece and those chronically ill patient population that you will choose yourself. You can really focus in on those lower ED visits and lower in hospitalizations because you are helping that patient with those care plans. Now, some other financial benefits. Those were kind of like some cost savings that healthcare spending will see. So what's some direct financial benefits? I get this question a lot. So one of the programs of individual payer here in the state of Kentucky, Humana, they do have a medical home program. If you are a PCMH, PCSP practice, or you are attempting to become a PCMH practice, they do have some incentives for doing that. They do have some requirements you can see there on the screen. You have to have so many covered patients that need to participate and those kind of things. But I would reach out to Humana if that is one of your payers to get some more information. If this is something that interests you, to see what that per member per month financial benefit can be, and to find out about that. Some other benefits that you're going to see is that Kelly and Jessica just talked to everybody about the quality payment program and the Mips program. So what are the benefits of that? If you are a PCMH recognized or PCSP recognized practice, for the improvement activity performance category, you get all full improvement activities credit for that performance category. If you have multiple locations, then at least 50% or more of your locations would need to be recognized in order to get that full credit. But if you do have that, you automatically get credit for that just by being a recognized practice. Now, also, it's going to prepare you for those value-based models. And we're going to talk about that here in a second. But PCMH, PCSP is going to prepare you, like I said, for the care management, coordination, quality improvement, which is essential as you move into that value-based model, or if you're in one currently, which this is our world today. So let's move ahead and talk about the value-based care. Since we just ended on that note about moving into those value-based models, you know, some of you may probably already know what a value-based model is. Some of you may not, but that's kind of what I want to talk to you about next. So value-based care. So looking at today, we all know this was pretty staggering. Back in 1960, 5% of our total economy was in healthcare. Well, back in 2016, it's about 18% of our total economy, which is over 3.5 trillion a year. And I'm sure that's increased since about 4 years ago. So we're kind of moving in the wrong direction, right? So we're trying to get that on the opposite side and start decreasing that. They also found that 6 in 10 Americans have at least one chronic condition, and 4 out of those have more than one. So 90% of our healthcare dollars are spent with people with chronic conditions. So you can see why focusing in on those chronically ill patients with those comorbidities for those care planning is so important, because that's where a majority of our healthcare dollars are being spent. So I found out that the New England Journal of Medicine, they had an article, and they found that a great value-based care model would be a patient-centered medical home, because it has that coordinated approach, and it has all of that foundation that is necessary and essential to have a strong value-based care model within your practice. So what is value-based care? Well, we all know what fee-for-service is. That's the world that we've lived in. That's the world we're still in somewhat, but we're really moving towards that value-based care. And that is based care that is based on the health outcomes and your quality of services that you have performed for that patient. And to see what, it's just different than that fee-for-service model where they're paid separately for each service that the provider did. Now the providers are being paid on how well the patient is doing. Did they improve? Did their clinical measures improve? Are they getting better? How much did you spend to get that patient better? What did you have duplicated tests? So all of that is an impact on value-based care. So it's more of a proactive approach to lower those costs and get more value built into that. And, you know, really working as a care team with that primary care provider and those other team members within that practice. And then, of course, your specialty practices and other healthcare facilities that coincide with that patient's health. So building a culture of quality is really important. NCQA talks about that, how it's really important to build that culture of quality with a quality improvement model and to be successful under a value-based model, so you can have that better patient care and be more prepared to manage that cost of that patient's health. So some other benefits for value-based care overall, you know, patients are going to have less costs. They're going to see improved outcomes. Your providers are going to have more satisfaction in a value-based care model and more efficiencies. And then your payers, those insurance companies, are going to have reduced risk. Their costs are going to be lowered. The suppliers are going to have prices that are more aligned with those patient outcomes. And then, you know, society, our population in general, is going to see that reduction in healthcare spending and better overall health for our country. So that is really some overall benefits for value-based care. And with that too, moving on, some health benefits of value-based care, you're going to get more preventative services, some risk factors for early disease that are detected, your chronic disease are more under control, and those fewer hospitalizations and readmissions. And then finally, some healthcare savings and expenditures. You're going to be proactive, more informed referrals, better care coordinations, more prescriptions for generic medications, those kind of things. And that list also includes some of the other items that I spoke of earlier. I hope that you can see, talking about the benefits of value-based care, what it is, how that correlates directly to PCMH. They're almost equal in my mind of, having a great value-based care program is being a great patient-centered medical home or specialty practice. They're almost one and the same. So if you have a strong patient-centered medical home, then you are going to have a strong value-based care model built already in your practice. So as we talk about how can you get this, how can you become a patient-centered medical home or specialty practice, or build that infrastructure within your organization so you can have this infrastructure set. So there's a couple different things for a personalized path to do that. And we've been working, as I've been working with PCMH, PCSP for 6 years now, we've come up with some new contract options. Of course, people can go for that full NCQA, PCMH, or PCSP recognition. If you think you're ready to go through that, you have a lot of those things already in place, you can certainly look at full recognition. But we've come across a lot of people that have asked, well, we're really not ready to do, full recognition yet. We'd like to have some pieces of that built, and we know it's important now. We just maybe not have the time or the resources to do the full recognition, but it would be good to have certain pieces. So we've come up, we're really excited about our new individualized module contracts for PCMH and PCSP. It follows that roadmap of that NCQA pieces to that puzzle. So we're really excited about that. And one of those individualized modules that we're looking at is a care management module. Talked about how important that is with those chronically ill patients. And I found some things in my research that ARC and the American Academy of Family Physicians have stated why care management is so important. It identifies those populations, it aligns those services, it boosts those care management skills, reduces your cost, it lowers the ER, all the things that we've talked about previously. Both of those organizations have, agreed that this is really important in your practice. So maybe this is something, if you're not ready for full recognition, but you're ready to maybe build that care management piece within your program, within your organization, to really get that into place and get those chronically ill patient populations taken care of and make sure those costs are reduced. And that's really going to help your quality piece of your organization as well, by focusing in on those patients. And also the next module that we're looking at care coordination. So maybe you really want to focus in on those referrals and sending those specialists out. Maybe you're not really getting the information back from that specialist that you send it to, or they're not getting the information that they need from you. So that communication needs to be improved. And you can see here the different benefits of having a strong care coordination module is, and ARC even agreed with that these streamline your efforts, increases that safety that's so important these days, and your efficiencies. So there's nothing as frustrating as when you go to your primary care doctor and they refer you out to a specialist, and you get to that specialist and the specialist has no idea why you're there, or they didn't get that x-ray that you did last week at your primary care's office. It's very frustrating. It wastes a lot of time. It wastes a lot of money. So really focusing in on those kind of things can be very beneficial. And then finally, last module is the quality improvement. The American Academy of Family Physicians agree that it prepares you for value-based models and the quality payment program. It's really essential to have that well-oiled practice. A functioning practice is having quality improvement built within your foundation. So we would focus in on that too. And today we've covered in some of our other sessions why quality improvement is so important. So how can we help you guys if you want to pursue full recognition, or if you just want to kind of focus in on some of those individual modules? and build those first before you think about moving on or just strengthening those concepts. Well, we can help by, you would get a certified content expert that is through NCQA, well, it's not through NCQA, but that's where the certified content expert certification comes through is NCQA. You get that personalized support, you find education on the different concepts, those modules that you may be looking at, help with submission if you do want recognition, to help you submit to NCQA through their QPath system, do some gap analysis to really find where those improvement areas are needed, and focus in on those as you move through that program or module. I'm really proud, since I've been here, and for 6 years to 7 years, we have helped over 130 practices pursue recognition. And every practice that has submitted for recognition, all of them have received recognition. So we're really proud of that accomplishment. Our practices work really hard. And so we're really proud of that. Finally, if you want to think about if you're ready for PCMH or PCSP, we have a free online readiness assessment that you can go to our website and locate that link and take that. It's a quick, short assessment that you can answer a few questions to give us some information so we can contact you and let you know kind of where you are, what the status of your readiness is, and maybe answer some further questions or details that you may have. It is free, there's no obligation or anything, but it'll help provide some feedback for you. And then finally, if you are interested, please reach out to us. All through our sessions, we've listed our phone number, our website, and our email address. So contact us anyway, and I'll be happy to answer any questions that you have about PCMH or PCSP with that program and those new modules. I'm here to help. So that really brings us to the end of our session today. I hope you enjoyed it. I hope I answered some questions. And Catherine, I don't know if we have time for questions but I'll hand it back to you.
All right, thank you, Vance. We do have one question I think we have time for, and that is, how does PCMH certification relate to FQHC certification?
Well, they don't relate as far as they don't have anything to do with one another. However, FQHC, a lot of the things that you have to do for both are similar. And with FQHC certification, I think there is some assistance that can be received from some programs that you can get some assistance as you go receive PCMH recognition. So that's something that we can talk to more detailed questions because it's different for every practice. But as an FQHC organization, there at least used to be some support and assistance financially for applying for PCMH recognition.
All right, thank you. And we've run out of time for more questions. So we will answer those after our event and we'll get in touch with you directly. Thank you so much, Vance, and really appreciate your presentation on patient-centered medical home and specialty practice.